cervical cancer. These two words strike fear in the hearts of women worldwide. The diagnosis can be overwhelming, bringing with it a wave of anxiety and uncertainty. While preventable and often curable, this disease still claims the lives of hundreds of thousands each year. Early detection and treatment are crucial, yet many women still face this daunting battle. But there is hope. A powerful weapon exists in the fight against cervical cancer: brachytherapy. This advanced treatment offers a beacon of hope for those diagnosed. Brachytherapy, also known as internal radiation therapy, delivers targeted radiation directly to the tumor site. This method ensures that the radiation is concentrated where it is needed most. This precise approach minimizes damage to surrounding healthy tissues, a common concern with traditional external radiation. By focusing the treatment, it spares the healthy cells and reduces side effects. Imagine a surgeon using a scalpel instead of an axe. Brachytherapy offers that level of precision. It's like using a fine-tuned instrument to delicately remove the cancerous cells. This innovative treatment method is changing the landscape of cervical cancer care. It represents a significant advancement in how we approach and treat this disease. By delivering high doses of radiation directly to the tumor, brachytherapy increases the chances of destroying cancerous cells while reducing side effects. This targeted approach is more effective and less harmful. It's a game changer for women battling this disease. With brachytherapy, there is renewed hope and a brighter future for those affected by cervical cancer. Cervical cancer remains a significant public health challenge, particularly in developing countries. It is the fourth most common cancer among women globally, with the majority of cases and deaths occurring in low and middle-income nations. Traditional treatments for cervical cancer, such as surgery, chemotherapy, and external beam radiation, can be effective. However, they often come with a host of debilitating side effects. These can include fatigue, nausea, hair loss, infertility, and long-term damage to surrounding organs. These side effects can significantly impact a woman's quality of life, both during and after treatment. The fear of these side effects can also prevent women from seeking timely medical attention, leading to later diagnoses and poorer outcomes. Brachytherapy involves placing radioactive sources directly into or near the tumor, delivering a high dose of radiation to a very localized area. This minimizes exposure to surrounding healthy tissues and organs, reducing side effects. There are two main types of brachytherapy for cervical cancer: intracavitary and interstitial. Intracavitary brachytherapy involves placing applicators, such as cylinders or tandems, into the vagina and cervix. Interstitial brachytherapy uses needles or catheters to implant radioactive seeds directly into the tumor. The procedure is typically performed under anesthesia, either general or regional, and may require a short hospital stay. The radioactive sources remain in place for a specified period, delivering a precise dose of radiation before being removed.
Maria, a 45-year-old mother of two, vividly remembers her cervical cancer diagnosis. It was a moment that changed her life forever, filling her with fear and uncertainty about the future. "It felt like my world was crashing down," she shares. "The diagnosis was overwhelming, and I couldn't help but think about my children and what would happen to them. But then my doctor told me about brachytherapy. He explained how it works and how it could specifically target the cancer cells with minimal impact on the surrounding healthy tissue. It offered a glimmer of hope. For the first time since my diagnosis, I felt like there was a light at the end of the tunnel." Maria underwent a successful course of brachytherapy, experiencing minimal side effects. The treatment sessions were quick, and the recovery time was much shorter than she had anticipated. "I was back to my family and my life much quicker than I expected," she says with a grateful smile. "Being able to return to my normal routine so soon was a blessing." Similarly, Sarah, a 32-year-old teacher, recalls her brachytherapy experience as surprisingly manageable. She had been worried about balancing her treatment with her teaching responsibilities. She explains, "I was nervous about the procedure, but my medical team was amazing. They provided me with all the information I needed and reassured me every step of the way. They explained everything clearly and answered all my questions. Their support made a huge difference in how I approached the treatment." Sarah experienced some fatigue and mild discomfort, but nothing compared to the debilitating side effects she had feared. The side effects were manageable, and she was able to continue working with minimal disruption.
These are just two of the countless stories of women who have benefited from brachytherapy. Each story is a testament to the effectiveness and life-changing potential of this treatment. Their experiences underscore the transformative potential of this innovative treatment approach in the fight against cervical cancer. Brachytherapy has given hope and a new lease on life to many women, allowing them to overcome their diagnosis and look forward to a brighter future. Healthy too. Section 7. A Brighter Future, Expanding the Reach of Brachytherapy. Despite its proven benefits, access to brachytherapy remains limited, particularly in low-resource settings. Factors such as cost, infrastructure, and trained personnel pose significant barriers to widespread adoption. However, efforts are underway to address these challenges and expand access to this life-saving treatment. International collaborations, such as the International Atomic Energy Agency's Programme of Action for Cancer Therapy, or PACT, are working to strengthen brachytherapy capacity in developing countries. These initiatives focus on providing training, equipment, and technical assistance to healthcare professionals in underserved regions. By empowering local healthcare systems, these programs aim to make brachytherapy more accessible to women who need it most. Section 8. Beyond cervical cancer, brachytherapy's potential. While widely used for cervical cancer, brachytherapy also holds promise for treating other types of cancer, including prostate, breast, and skin cancer. Its ability to deliver targeted radiation makes it a valuable tool in the fight against these diseases. Researchers are exploring new and innovative applications of brachytherapy, such as high-dose rate brachytherapy, which delivers radiation over a shorter period, and image-guided brachytherapy, which uses advanced imaging techniques to optimize treatment delivery. These advancements have the potential to further improve treatment outcomes and reduce side effects for patients with various types of cancer. Prevention. In Section 10, join the fight together, we can make a difference. The fight against cervical cancer is a collective effort. By raising awareness, supporting research, and advocating for increased access to care, we can make a difference in the lives of women worldwide. Support organizations like the American Cancer Society, the National Cervical Cancer Coalition, and the World Health Organization in their efforts to eliminate cervical cancer as a public health problem. Together, we can create a future where every woman has the opportunity to live a long, healthy life free from the threat of cervical cancer. Don't forget to like, share, and subscribe to our channel for more updates and information. Click the bell icon to stay notified about our latest videos.